Hello everyone, welcome back to Sowkya Vision. Today we are going to discuss axillary artery. In the last class we have completed axilla, introduction of axilla, its boundaries and the contents of axilla. Yes, today we are going to see the axillary artery, its branches and etc. Here we go. The axillary artery, it is the continuation of subclavian artery and continued as brachial artery, the main artery of upper limb. Yes, it is a main artery of the upper limb. Yes, it extends from first rib. It extends from the first rib to the lower border of the teres major. Yes, it is continued as brachial artery at arm. It is continued from what? Subclavian artery. Yes, it is continued from subclavian artery at the outer border of the first rib. At the lower border of the teres major, it is continued as brachial artery. Yes, when it is in its course, it crosses pectoralis minor muscle. See, if it is a pectoralis minor muscle, this is the axillary artery. So, the pectoralis minor muscle and axillary artery. Yes, so the pectoralis minor muscle dividing axillary artery into three parts. Yes, the part above the pectoralis minor, the part at pectoralis minor and the part below the pectoralis minor. So superior, the posterior with pectoralis minor and here inferior. So the pectoralis minor divides axillary artery into three main parts. First part, second part, third part. Yes, first part is posterior to pectoralis minor and second part is posterior to pectoralis minor. Third part is inferior to pectoralis minor. Yes, this is the pectoralis minor muscle. Here it is. So it will be presented back like this. Yes, the first part, second part and the last one is the third part. And now the relations of axillary artery. The axillary vein, it is very important. The axillary vein is always presented medially to the axillary artery. Yes, axillary vein is always throughout its course is presented medially to the axillary artery. Now let's see the branches of axillary artery. There are 6 main branches of axillary artery and it's very easy to remember. 1 branch from the first part, 2 branches from the second part, 3 branches from the third part. Let's see that. From the first part, the first artery, the first branch is superior thoracic artery. Yes, the first branch of axillary artery, that is from the first part, is known as superior thoracic artery. It is presented near subclavian muscle. Yes, it is present near subclavian muscle and extended between pectoralis major and minor and supplies to pectoralis major and the minor muscles. Yes, now from the second part there are 2 branches, thoracoacromial branch and lateral thoracic branch. The thoracoacromial branch is arised at upper border of pectoralis minor muscle. Yes, it is arised from upper border of pectoralis minor muscle. See, this is the axillary artery. As I said, it is divided into 3 parts. This is the pectoralis minor muscle dividing first part, second part and the third part. Yes, it is continued from subclavian artery and continued as brachial artery. Yes, as it is divided into 3 parts. The first part containing 1 branch, second part containing 2 branches and third part containing 3 branches. Yes, the first part branch is superior thoracic artery. Yes, the second part containing 2 branches, thoracoacromial artery and long thoracic nerve. Yes, these are the 2 branches from the second part. As I said, the thoracoacromial artery is arised at upper border of pectoralis minor. Yes, this is the pectoralis minor upper border. So here it is arised. It is dividing into 4 main branches again. What are the 4 main branches? The pectoral branch, deltoid branch, acromial branch and clavicular branch. Yes. Now the second branch from the second part is long thoracic artery. Long thoracic artery. It is presented along lower border of pectoralis minor. Yes. The first part along upper border, second branch is along, that is second branch from second part is along lower border of the pectoralis minor muscle. Yes, it supplies pectoralis major, pectoralis minor, serratus anterior. Yes, this branch is large in females. Why it is large in females? In order to supply to the breast. Yes, to supply the breast it is large in females. Now, what are the branches from the third part? There are 3 branches from the third part. The subscapular artery. Yes, see, this is the third part. Third part, the first branch from third part is subscapular artery. This is a subscapular artery. Yes, and it is presented along lower border of subscapularis. It is presented along the lower border of subscapularis and ends at lower or inferior angle of the scapula. Scapula containing 3 angles, superior, lateral and inferior angle. So the subscapular artery is ended at inferior angle of the scapula. So it has the main branch, circumflex scapular artery. So the branch of first branch of third part of axillary artery is circumflex scapular artery. This is the circumflex scapular artery. Now the second branch from the third part is anterior circumflex humeral artery and the third branch from the third part is posterior circumflex humeral artery. These 2 arteries anastomoses each other. Yes, the anterior circumflex and posterior circumflex humeral artery anastomoses with each other. Yes, and this is the discussion of subclavian. This is a complete discussion of axillary artery. So if you have any doubts, please comment in the comment section. Do like the video, subscribe the channel and support. Thank you.